One of many tasked with leading the fight against the COVID-19 pandemic is Lieutenant Governor Spencer Cox. One thing he's pushing for is more testing in the state. In a one-on-one interview, he spoke with ABC4's Brittany Johnson about what is being done to stop the spread of the virus in our state. It's our next installment of Community Over Crisis.
Confirmed cases of COVID-19 continue to rise daily in Utah. Lieutenant Governor Spencer Cox says increased testing is the way health officials are going to be able to slow the spread of the virus and fatalities that come with it. Wednesday, the nation's deadliest day since the COVID-19 outbreak began.
This is really unprecedented, unlike anything that any of us have seen in our lifetimes.
A deadly and distant virus has washed upon our shores, and the wake from this pandemic is striking closer to home.
The countries that have been able to get ahead of this have done it through testing, contact tracing, and isolation.
With more than 300 confirmed cases of coronavirus in Utah and one death, Lieutenant Governor Spencer Cox says saving lives comes down to testing.
We are social distancing, and that piece absolutely matters to slow the spread of it. But to get really surgical about what we're doing, this is the only way to do it. And we can't do it if we don't have enough testing.
Health workers are now testing 2,600 Utahns daily. And according to the Lieutenant Governor, with the increase in testing, health department officials will have a more accurate assessment of how fast and widespread COVID-19 is here in Utah. But more importantly, they will have a better idea of how to contain and slow the spread.
And once we can find those positive cases, we can isolate them. We can go back and do what we call contact tracing, find out who they've had contact with over the past several days.
Like Cox said, the coronavirus global pandemic is unprecedented, and the little testing that was being done at the outstart was making it difficult to slow it down.
It did make it impossible for us to know exactly where it is, which is why we were the first state to limit mass gatherings to 100 or less. We closed schools very early on. We were one of the first states to do that, and we had to do that because we didn't have a good sense.
Just last week, health officials were testing about 500 Utahns a day. And weeks prior, less than 100 Utahns were being tested. The frightening question, with so little testing being done, how many Utahns are really walking around with coronavirus?
There's some data out there that shows for every positive test you get, there are probably 9 other cases that are out there that haven't been tested yet.
Even though close to 3,000 Utahns are now being tested daily, the man who is leading the fight says not everyone will get tested, even though a test could mean the difference between life or death.
It's impossible right now, just by the sheer numbers, to test everyone.
Despite the test shortage, Cox says he and others on the front line of this battle are working around the clock to do everything they can.
It's definitely a concern for all of us. And again, we're trying to find that balance between saving lives and making sure that we're doing everything that we possibly can. And so we're watching those numbers very, very carefully. Again, we have our experts that are looking at this and making the very best decisions possible.
Experts say the most difficult days lay ahead, and it will take a community to weather the approaching storm.
I don't want to overwhelm people or give them a false sense of security. We know that there are difficult times ahead, and I think it's important to share that message as well. And my hope is that will inspire people to do their part and to make sure that they're not spreading this.
Reporting in Salt Lake City, I'm Brittany Johnson, ABC4 News.
Coming up tomorrow night at 10, part 2 of Brittany's interview with Lieutenant Governor. We dig into how prepared Utah officials were for this pandemic and look ahead to long-term impacts this can have on the state.